Hello, everyone. Welcome to the virtual Cardio-Oncology Summit. My name is Dr. Dinesh Thavendiranathan. I'm a cardiologist and associate professor of medicine at the Peter Munk Cardiac Center at the University of Toronto, and I'm the director of the Ted Rogers Program in Cardiotoxicity Prevention. You are currently attending the Satellite Symposium of the Virtual Cardio-Oncology Summit, focused on the role of cardiac imaging in cardio-oncology. There are two presentations today, one that's focused in the field of cardiac MRI, and this one that's focused on the role of echocardiography in cardio-oncology. I have no relevant conflicts of interest. Most of you who are watching are well aware that patients with cancer experience a broad spectrum of cardiovascular disease. This includes left ventricular dysfunction and heart failure that are commonly seen with certain therapies. It's often associated with poor prognosis. Asymptomatic left ventricular dysfunction has been reported to be as common as 10 to 40% with certain therapies, such as women receiving breast cancer therapy with anthracyclines and trastuzumab. Echocardiography plays a key role in the field of cardio-oncology, but specifically in the assessment of left ventricular dysfunction and heart failure. It has a role in pre-treatment risk assessment, early identification of myocardial injury, either during treatment or in survivors. Again, identification of stage B heart failure, both in patients receiving cancer therapy and in survivors, and monitoring recovery and supporting reinitiation of cancer therapy. I have put stars next to each one of my statements that reflect the abundance of evidence to support the use of echocardiography for these various applications. The toolbox to identify left ventricular dysfunction includes chamber remodeling, which is usually identified based on change in left ventricular volumes, a reduction in left ventricular ejection fraction as a marker of myocardial injury, changes in myocardial strain, including global longitudinal strain and global circumferential strain to identify subclinical myocardial dysfunction, and more recently, emerging evidence that looks at the value of diastolic dysfunction as early marker of injury to the myocardium, especially in the context of anthracycline therapy. I'd like to remind the audience that there's a broader role of echocardiography in the field of cardio-oncology that includes assessment of coronary artery disease, valvular heart disease, pericardial diseases, and masses that can often be seen in our patients. We have a spectacular group of individuals who will be addressing various topics with the application of echocardiography in the field of cardio-oncology, and I'll introduce these speakers to you, and you'll be able to listen to each one of their presentations. First is Dr. Covadonga Fernandez-Golfin from Madrid, and she'll be discussing how advanced echo improves baseline risk assessment. Specifically, she'll focus on the role of 3D echocardiography. We have Dr. Ann Blaze from Minneapolis, who will discuss asymptomatic left ventricular dysfunction. Is it clinically relevant? And this comes from an oncology perspective. We have Dr. Jennifer Liu, who will discuss drop in GLS and what does it mean, and she's from New York. Dr. Karamida Kalliopi from Athens, who will focus on advanced focus echo in cardio-oncology, where she will discuss certain dedicated views and imaging approaches to address different issues in the field of cardio-oncology. And Dr. Anita Arnold from Fort Myers, who will discuss the role of advanced echo in cancer survivors. Hope you enjoy these presentations.